what we wanted to talk about is adult learning principles. And the way that we came to this is, I guess for me, a realization that as faculty, we often know our subject inside and out, but we're not necessarily taught about how to teach it, and especially how to teach it to adults. So that's what we're going to spend a good deal of time on today. And I guess I'll let Susanna introduce herself and we'll go from there.
Thank you, Carrie. Well, welcome to you all. I am Susana Henriques. I am a professor at the Portuguese Open University in Lisbon, but everywhere because it is distance learning. I work with digital education, and I'm a researcher also and a collaborator with ICU DDR.
Yes, we are lucky to have you. And some of
Thank
you
you.
may have seen that Susanna and I have done some trainings. Some of what we started working together on during the pandemic was helping facilitators, helping educators like yourself in similar vein, except in that case it was, you're doing emergent learning to deal with the pandemic. And so a lot of people who weren't used to doing online learning had to move to that. So I'm Carrie Hopkins Isles. I know quite a few of you, if not from working with you on trainings, at least from emailing and contact in one way or another. I'm a certified addictions professional, a global master trainer for UTC, the deputy director for ICU DDR, and I'm an instructor here in Florida at the University of South Florida in the areas of criminology. So that's what my master's is in. And I just want to say that you guys are all involved today in our pilot for this training. So we put some responsibility on you in that we need your help to see if we're going to do multiple modules of this about different adult learning principles. And we need your feedback on, what are things we could do better? What are some things you really liked? Format, all different things. So we'll be asking you some of that afterwards, but if you can just be keeping that in mind, that I think those who know me know that I'm very open to that anyways and always want feedback, but we are specifically, Susanna and I are specifically putting this out there with the idea that we really want to know, are there things we could do differently, which is a big part of adult learning principles, that we want to be flexible. Right, Susanna?
Well, for the introduction and our presentation, we have this little challenge for you. Please choose an object that is nearby, that you have there with you, and that is meaningful for you. You don't have to think much. Just pick the one which is near and it is meaningful in some way. Okay? Is it okay for everyone? Yes? Okay.
Yes.
So, want to start? Please say tell us about yourself. Please say your name and what you do with your students, and who are your students. What are your main difficulties as an educator, and the main strengths you have as an educator also. And then why you choose that object. Who wants to start?
I can start.
Okay, great. Great,
Good
Fatima.
morning. Let me see if I can get my video working. There it is. Good morning, everyone. I'm Carol Lemus. I am based in New York in the United States. I am the Director of Health and Wellness for an agency that houses the homeless. Our population is primarily people with HIV, people with mental health disorders, young people coming out of the foster care system, across the board, their substance use. They are all adults, and to a large extent have not had successful academic experiences. They don't have positive perceptions of traditional learning, yet they have enormous life experience. And we do a lot of education based on Paulo Freire and his theories around empowerment education. So that's a little bit about us. I actually chose a photograph of a cat that we had for 13 years and had to put down last week.
Mm.
Oh, so recent. I'm sorry.
Thank you.
So excited that you're here. Thank you.
Thank you for sharing. Um,
May I go
and
on?
thank you for your presentation and for all this contribution. Let's hear some more colleagues and then we come back. Next.
Rabia was ready.
Yeah.
Okay, great.
I'm Rabia. I'm a psychiatrist. I am a chief physician of a mental health hospital, which psychiatry and neurology residents are there. And we have inpatient and outpatient clinics, almost 250 beds. And I'm also working with University of Health Sciences. I have a doctoral program on addiction fields there. So my students are usually doctoral students on addiction field, and also psychiatry residents in general psychiatry. For me, when it is hard for me, I'm always motivated for. I'm 45 years old, and I always feel like a student, and I try to learn more. When I see some training, I hear about some trainings, I try to register and learn more. I always feel as a student. But when, for example, if I share something with my students and want to make an training, and if I don't see them as motivated as myself, I get easily, my motivation gets easily decrease. My English isn't so good, so I'm sorry for it.
You're doing perfectly.
This is my weakness. And my strongness is I can share them if I do not know the answer of their question, of if I am not familiar with the topic. I can easily share, and I can say that, oh, I'm not good at this issue. Let's search together. We can search together. We can learn, and if we learn, let's share with us. So it's not hard for me. I like this, and I choose my pen here. It was next to me because I always keep notes with it. I always have some notebooks here, although the time is digital time. I keep writing them on my notebooks. Thank you.
Thank
I
you.
can relate to a lot of what you said. I love the vulnerability. Thank you.
Thank you. Thank you very much.
Susanna, we have Ariel Jara is a psychologist, works in the Taller del Maestro therapeutic community in Paraguay. Graduated from the UTC of the Colombo Plan for 3 years. They've been training, so they appreciate this opportunity. But couldn't share verbally because their internet is coming in and out.
Mm-hmm. She doesn't refer the object.
No, he did not, but
Maybe next. Okay.
yes.
Next.
May I?
Yes, please.
Okay. Hello, everyone. I am Aisha Siddiqa. Basically, I am working with two countries. I am Global Master Trainer for Colombo Plan for UPC and also for the UTC. I'm working with Colombo Plan since 2010 and with UNODC since 2012. So, we work a lot on in Pakistan and different countries related to addiction prevention, and especially for this course. This course is very much significant for me, and I'm thankful to Kerry because I email her and she just on not only me but she also gave a chance to my colleague Mr. Zunoran. He's also here. Actually, we are working currently. We are working with STCM. It's a Supreme Training and Consultancy firm. It's in Malaysia. I I've completed my postgraduate diploma in addiction sciences. That was a scholarship from Colombo Plan in 2019. And after that, I decided to bring this education in my country, in Pakistan, not only in Pakistan, but in other countries where we have a lot of treatment professionals, but they do not have any university credential or degree. So we started work on that, and in 2020 we did a lot of work like international credentialing system. We actually recognized our degree. We're supposed to recognize our degree, course content, and everything. And at this stage, now we are successful, and we are successfully signed one MOU with us, two state universities of Malaysia. And we are also going to sign MOU with one medical college and two universities of Pakistan. And we are going to start 1 year postgraduate diploma in addiction sciences and then master's in addiction sciences from January 2020. So for me and my colleague, this course is very, very much important because we are just going to teach all the people who are adults, not only adults, but they are the professionals. You know, we have a lot of professionals around the globe in this field, and some of them they are youngsters, and some are they are in the early career, mid career, and some are on the senior level. So most of them they are very much excited to especially have a university degree in their most relevant field. So this is my introduction. And object, uh, I would say, it is my mobile phone because since the pandemic situation, everything is now digital. So most of the time, I'm checking the emails because I recently joined a consultancy with my government of Pakistan, and we are working on the prevention health system in Pakistan, especially the legislation on civil registration and prevention policies. So it is very significant for me. I can check my emails, I can be connected with my colleagues and with multiple trainings, etc. So this object is much more significant for me, what I can say. Thank you.
Thank you. Thank you. It's very, very important. It's very true. With the digital environment, the cell phone is very important. And it is not only for entertainment, but it's also for education, information, and interaction. And it is very, very important nowadays. Next.
Hello, everybody.
Hello, please.
May I? May I?
Yes, please.
Okay. My name is Maria Ilubuhi. I'm from Nigeria. Okay, so I think the internet threw me out. So I hope if I'm not going according to the rules, please just draw me back. Okay, so what do I do? I am an sorry. I'm a counselor by training. Formerly, I used to be in law enforcement. That's where I met Fatima. She's still in law enforcement. So I left. I started at NGO, the Shelter Youth and Community Network. I am a global master trainer for Colombo Plan UPC. That's the prevention. And I also am a master trainer for UNODC Nigeria. Our organization is a training provider for UPC. in Nigeria. So what do we do with our students? Before now, most of our trainings had been physical, yes. So we disseminate the trainings. Sometimes I train on behalf of other education providers, and even for UNODC, it's basically on sensitization, all drug related. So that's what I do. So challenges with the people that I do trainings with. Well, I think that sometimes the challenges are with the concepts that they already had before coming to the training. And sometimes these concepts are really, really difficult because, I mean, this is conventional knowledge that we all had, we all believed in before. So changing these narratives is sometimes a bit challenging for all of us. But then, of course, at the end of the day, everyone agrees with what science is saying. So what's the thing that is closest to me now? Something that is very useful to me is my new computer, my new laptop. I'm really so excited about this laptop because the former one I had was really quite heavy. And I was really, really praying and desiring a laptop that is a bit light because I travel a lot for trainings and always having to carry it. So the laptop is very useful to me because it helps a lot with the slides. And I've also found a way of also inculcating other things to explain my slides the more. Like I like to bring slides in between slides. And most times, especially for UPC trainings, these days I hear participants say, but we don't have that on our own manual. I say, no, I created this. I like the fact that it gives me that versatility to create slides, to add more meaning, to add life, to bring those things that I teach to life. I hope I tried to cover some of the things you asked. Thank you.
Very nice. Thank you, Carrie.
Susanna, a couple people
Sorry.
are doing it in the chat, I assume because of connectivity. I don't know if
Okay.
you can see that.
Do you want to read it?
I will read them, but I'm not going to try to pronounce people's names because that is a fool's errand for me. I'm terrible. So someone says that they are a psychologist and lecturer. They teach undergrad psychology courses here in Nigeria. If anyone wants to pronounce that, please do, because I slaughter it. Fatima, you have a guess there how that's pronounced?
Can I go on?
Can you help me first? How do you think that person's name is pronounced with the O?
Okay. Let me check the name.
Please.
What's the name? Let me check. Ogochukwu. Is that Ogochukwu?
Yes, I think it's Ogochukwu.
Yes, Ogochukwu.
Thank you.
And Ogochukwu.
Yes.
And then Zunurain is working with STC Malaysia as a trainer and coordinator for university program postgraduate studies in addiction sciences. They're a drug and alcohol counselor, ICAP certified, currently conducting trainings in Malaysia on DDR, and they say thank you for this opportunity. Okay, Fatima, the floor is yours.
Good afternoon, good morning, good evening, everyone, wherever we are. My name is Fatima, and I'm lucky to have two of my mentors here this afternoon. Carrie, shout out to you, Carrie. Thank you for everything you've been doing. And Maria. Maria is another mentor of mine. Am I not lucky? I have two of my teachers here this afternoon. I'm a counselor. I am a researcher. I'm a writer, and I teach a lot too. Mainly, I'm in law enforcement, just like Maria said, and we are in charge of rehabilitation of people who use drugs, and from there we proceeded to learning from different people like Carrie, like Maria, learning more on the job. So it's not been easy. especially when you are a trainer. I train people too, and I have a lot of challenges when training adults. In fact, I want to even think that training adults is a bit difficult than training children. I was in a training with Maria, and all the people there, everyone they were just on their own. You know, I was a bit frustrated, and I was telling them that they were making noise. I remember Maria said, don't say that next time. Don't tell adults that they are making noise." It was almost frustrating for me, you know. So I think training adults is not easy. And I wish to learn more, you know, in this training, you know, on how to really train adults, how to find it easy when you are training adults. The object I chose is the pen, because I like to write a lot. I have my note here too. I write a lot because I'm a writer, I'm a researcher. Anything I see, I jot it down, I write it down so that I don't forget. So I'm happy that I'm here with all of you, and I hope to learn from everyone. Thank you very much.
Thank you. Thank you very much. I think we miss a few. Yes, please.
Okay, can I go ahead?
Yes, yes, please.
Okay, so my name is Rihanna and I'm from South Africa. By profession, I'm a clinical psychologist. I'm also a global master trainer and I do a lot of training as well. And I'm a senior lecturer at University of Cape Town. I think my strength is that I like personal contact and interaction with people. So my challenge would be the direct opposite, is in terms of teaching online, and hence I registered for this course because I think that's going to help me strengthen my training abilities. The object I chose, but I'm not going to talk about it a lot because the first participant, Carol, I really feel for you in terms of losing your cat. I have 2 cats and I have this little cat ornament and a little paper clip with a cat. So they bring a lot of joy, and I can imagine the loss that Carol feels after losing a cat for 13 years. And my heart just sank when I heard about that. So yeah, it's already, we have so many things in common with other participants. So thank you for this opportunity.
Thank you. Thank you very much. Next. Yes, please, Tania.
Hello, my name is Tania de la Fuente. I am from Mexico, and I work also as a master trainer from UPC. And I am so glad to see the Rihanna, because he was one of my teachers a few years ago. And also I work in one of the largest universities in Mexico, and I am a teacher, undergraduate and postgraduate teacher. And as I hear the other presentations, we are in the same page. We work doing our class by Zoom, using different platforms or different apps in order to give some activities, and the interactive activities through the technology. I don't know. I work as a clinical psychologist in the afternoons, working with the patients and families.
Mm-hmm.
So nice to meet you, everybody.
Did you choose an object?
For this course? Yes. Yeah, I would like to have the opportunity to share some of my experience, and also learn about different experience about how to do better our job as a teachers.
Okay, thank you. Thank you. I think we missed 2 persons. David and Diana. Yes.
Good afternoon, colleagues. I'm sorry I came late, so I don't actually know what to say, not to say, but I'll say maybe from observing hearing what other people were saying. I'm David Sydney Mangwegape. I'm from a country called Botswana. I work as a nurse educator. I basically facilitate learning of a post-basic diploma in psychiatric mental health nursing. Basically, it's nurses who are on the field and they come back for their psychiatric nursing. So basically, the module will help a lot because I'm actually teaching adults. And I'm also an addiction professional, ICAP too. And I'm also a newspaper columnist. I write basically on mental health issues. Thank you.
Thank you. Thank you.
Most welcome.
And Diana, maybe?
She might be having connectivity issues because she came in.
Maybe.
this
Yes.
couple, so.
Yes. Thank you. So, as I told you, I work with digital education. This is my turn. And my students, they are all working adults with families and complex lives beyond study. So this is the major challenge. For me as a professor, my main challenge was being a sociologist, and I did not have any pedagogical background to teach when I began at the university. So it was only when I got to the Portuguese Open University that I had some training on online pedagogy, and then I've been developing these issues and these skills. My main strengths, I think, that I love teaching because I always learn a lot with my students, with all of you, with their experiences, because they have job experiences and life experiences so rich, and that is so important when they bring that to the learning experience. And it is something that is meaningful for them and very enrichment also for us as professors. The object that I choose is something that I usually use when I do this exercise, is a photo with a silhouette. I think I was trying to, yes, it's just a silhouette, a black silhouette. And I use this image because it's something that illustrates what we can do with this dynamic. We start almost with this image of each other, and then we know some more things. We know that Fatima is a writer. We know that I'm sorry, I must look to my my notes. We know that some of us have a new laptop. I'm sorry, I can't find your name, but I wrote it. I know that some of us like cats. I myself lost a cat that I had with me for 18 years, so it's one lifetime. And so we know now more things that we knew before. And usually when we do a presentation, we usually say our name, our job, our profession, and we say nothing more than that. And it is possible with some strategies to know more about each other. As Rihanna said, we find common issues and common interests and characteristics between all of us. And that is important in the pedagogical relation. Carrie, do you want to?
You want me to take a turn or you want me to keep going?
Yes, you keep going, please.
Okay, here we go. All right, well, thank you so much. I always love getting to know you all more. So we're going to talk about andragogy. That's how I pronounce it, at least. I practiced a lot. To understand, we have Knoll's theory of andragogy as our goal today. Analyze and discuss two of the components of that, which are self-directed learning and motivation. To critically comment on the planning for teaching and learning from concrete examples, and to collaborate as a group. So what is andragogy? The method and practice of teaching adult learners, adult education. It applies to any form of adult learning and has been used extensively in the design of organizational training programs. So whenever we're ideally a well-created program for adults will be using these principles. And so we're going to talk a little bit about how the principles are different for adults and children. And I really liked Fatima's example, and it was very vulnerable, and I appreciated that. I have that same problem where I have students in class and I try to treat them like adults, and then if they're talking, there's a part of me that's like wants to say, no, you're adults, I'm talking. We don't do that, but we don't want to make them feel disrespected or like they're children. So now in pedagogy, we're teaching academic or theoretical subjects, and this is what we all became familiar with learning as children, right? So if you haven't had specific training on teaching and teaching methods, you're probably using a lot of the things from pedagogy because that's how you were taught. And so that's what we do. Right? Now, here are some differences. In pedagogy, students basically just accept the information they're given. I kind of like the image of a student sort of sitting at the foot of the master or at the foot of their teacher, right? They have little or no experience and they rely on others to decide what's important. You know, the vulnerable, the clean slate of a child. In andragogy, they validate the information based on their own beliefs and experiences. So if you come to our course today and we tell you something and it doesn't quite fit with what you've experienced in life, you may kind of dismiss it. You might already have certain viewpoints when you're coming into courses because we're adults and we have different ideas. And you're going to decide for yourself what's important for you to learn. So this group already self-selected, right? You decided it's important for me to be a better teacher. And like I said at the beginning, I respect that so much. And there are other people who saw that option. Oh, there's a course that could help me be a better trainer, and decided that wasn't really, priority for them in this day. So I'm not going to go into this in a lot of detail, but it's the same idea, just kind of built up more, and you guys are welcome to have the PowerPoint. But this idea that, sort of the difference between students when they're children versus when they're adults. So Knoll's had this theory of andragogy. It was an attempt to develop a theory specifically for adult learning. And now we're going to go into some more specifics. He emphasized that adults are self-directed and they expect to take responsibility for their decisions. And so therefore, as adult learning instructors, we have to accommodate this. This is a main piece of what we know about adult students. So he had 5 key assumptions about self-directed learning. He said that self-directed learning assumes the human being grows in capacity and needs to be self-directing as an essential component in their maturing. He talked about the fact that learners' experiences become increasingly rich resource for learning. So we all know we're coming today with all of our experience, and that's what makes this so much more valuable than if we weren't able to share anything about what we do. Self-directed learning assumes the individuals become ready to learn what is required to perform their evolving life tasks or to cope more adequately with life problems. Self-directed learning assumes the natural orientation of individuals is task or problem-centered. This is also a separate adult learning principle that he talks about a lot that we can talk about in this course, which is we want to make our learning problem-centered or problem-oriented or solution-oriented, ideally, right? And then self-directed learning assumes learners are motivated by internal incentives such as the need for self-esteem. And we're going to spend a lot of time on that. So the interesting thing with self-directed learning is that it can be both an instructional method and a personality characteristic. And I think Rabia brought this up. So it's a method that I want you to be self-directed because you're adults and I want to respect that you can be. But then it's also a personality characteristic, like Rabia highlighted, where not everybody is going to be as able to kind of take the ball and run with it if you give them self-directed learning due to motivation and engagement, which we'll talk about. So that can be kind of confusing, like, am I a self-directed person or am I in a course that's more self-directed learning? So what does this mean? Self-planned learning is a learning activity that's self-directed, self-initiated, and frequently carried out alone. So for example, when you give your students assignments and they have to determine when they're going to work on it, where they're going to work on it, but maybe, you know, this self-initiated idea, maybe you give them really broad characteristics so they don't have to do it specifically at a certain time, certain place. So broadly defined, self-directed learning refers to activities where primary responsibility for planning, carrying out, and evaluating a learning endeavor is assumed by the individual learner. And so the idea here is that adults have a deep need to be self-directing. We don't want, we hear about micromanagement, right? We don't want someone telling us, okay, now you do this, and next you do that. And so individuals who take initiative in learning tend to learn things and learn better rather than someone who's just kind of waiting to be taught. Self-directed learning is more in tune with our natural processes of psychological development, sort of moving towards, if you look at hierarchy of needs, we're getting up towards being enlightened or being, you know, more fully in ourselves. Many new developments in education put the responsibility primarily on the learner. Now, this doesn't mean certainly that we just say, okay, it's on you, and now we have no responsibility. We're just treating our students like adults, and we're giving them the flexibility and level of creativity that is needed. So I liked this quote: true self-education can only occur when a person chooses to learn what he can also decide not to learn. And you're all a perfect example of that. You could go on with your lives and keep teaching and working with the people you're working with and the homeless population and all these other places and just say, this is fine. But you're all choosing that I would like to be better. I would like to learn these principles and try to apply them. So when we look at self-direction, what this means is that as the educator, we're facilitating the process. We're giving feedback, we're giving support. We're not teaching people basic information, we're helping them to grow. You could all look up what we're going to tell you today, but we want to have collaboration, conversation, share our experiences, put it together for you in a way that makes sense, so that you're not just, okay, here are the definitions. So self-direction includes a process by which individuals take the initiative in determining what their own learning needs are, formulating learning goals, choosing and implementing appropriate learning strategies. Now, we can't always just let our students learn, you know, we can't just say, oh, what do you want to learn? And we do that. But like with Susanna's example today, when we bring to the table, when we ask our students, what are some things you want to learn? What are some of your weaknesses or challenges? We can somewhat tailor to that And then our students are feeling heard. They're going to be more engaged because this is what I needed to know. This is why I'm here. And so one of the things that has to happen is that the students have to determine, this is worth my time. You are all incredibly busy, and you've decided today that this is worth your time, and we need to do the same with our students. So as I said, we don't just say, here, go learn this. We have to, I like to look at it as what we do as clinicians with motivational enhancement. We talk about, I think you guys have answered why you're taking the course for the most part. We talk about with students, or we talk about with our clients, what are the reasons, what's your internal motivation? You know, you have this problem, you need to get from A to B. What's the thing that's going to get you there? And I think it's very similar with our students. If you have a student who says, I really want to get my master's, or I really need to get my degree for this reason, or whatever it is, we need to be there to help with those steps to get through. So in the interest of time, I'm just moving through a couple of these. So one of his principles specifically was about motivation. Now, Knowles felt that adults are internally motivated to learn. And I was really interested in this assumption because I thought, yeah, but no, I wasn't, you know, I had different feelings about it. So he had these assumptions here about self-concept and readiness to learn. And he added that as a person matures, the motivation to learn is internal. But I guess it depends on what your definition of internal becomes. Because if your boss said to you, in order to keep your job, I need you to get your ICAP. If you're working to get your ICAP because you would like to maintain your job, is that an intrinsic or an extrinsic or external motivation? Maybe both, right? So it becomes, I think, a little bit trickier. Now, a concept that was brought to my attention, Susanna brought this, is motivation versus engagement. So I really love this. Motivation is about energy and direction, the reasons for behavior, why we do what we do. Engagement describes that energy and action, the connection between the person and the activity. And so basically, we can promote motivation and engagement with our students by setting up conditions that make them, you know, engaged. They feel this is like a lively conversation. This is a challenging learning experience. Or we can inadvertently, you know, not intentionally set up learning experiences that trigger them to just be disengaged. And so that's what we're hoping to avoid and work on with all of you. So like I said, Knowles made an assumption about adults' motivation to learn. He noted that children have external motivators, such as parents, and he claimed that adults don't have the same external motivators, that we each have internal motivators unique to each of us, which is true. He said adults may learn best when their motivation is internal, but then as I mentioned earlier, you know, we want to be, I guess I want to be compassionate to what people's motivations are, because as we get older, it becomes a little blurrier in my mind. You know, we would like to find internal motivation, but that internal motivation may be to be successful at work. So like I said, I guess something I think would be interesting for all of us to think about is wanting to get a raise or a promotion considered intrinsic motivation? Is wanting to improve skills or improve your life internal motivation? And should you just, or are we basically being asked to want to learn for the sake of learning? I think a lot of us do, but I don't think that it is wrong to have something else that's part of that. I like to think about MET and the idea that, you know, we can apply a lot of these things to our students. We can be empathetic for whatever it is that they may be going through or what brings them to us. If they're not fully committing to what the class is or what the program is, we can develop discrepancy. You know, I know you're really busy, but I also know you've expressed to me how important it is for you to complete this course and those kind of things. Obviously, we want to avoid argumentation and roll with resistance. And then we support self-efficacy, just like we were talking about with self-direction. So there was an adaptation to the original assumption that said that adults are motivated to learn by both intrinsic and extrinsic motivators. And I would agree with that. All right, Susanna, into planning for us, darling.
Yes, thank you. Please feel free to interrupt and ask any questions or make a comment, okay? Okay.
May I have a question?
Yes.
Because it's related with motivation. I really wonder the role of trainer for the motivation of the learner, because yeah, as I said before, we have some students, they do not seem very motivated, but I wonder if it can change. What is our role for changing the motivation? Because as I understood from Carrie's presentation, self-directed approach is something like an individualized program. You mean that we cannot put things same for all learners? Each student have different motivations, different styles. But if, for example, in my case, if the number of the trainers isn't too much, the number is less and you have lots of students,
Yes.
lots of works to do. So you usually use the same methods for everyone,
Of
not an
course.
individualized program. So I really wonder about how can we manage for an individualized style, and how can we what's our role for changing the motivation? That's all.
No, I think I'm so glad you brought that up, and I'm going to say some and then hope Susanna will dive in. I feel like, first of all, you had a few questions, but I agree. It's very difficult. Like I just finished a semester of a university course with 80 students. I can't let them just do, obviously I'm not like, okay, just learn there's no way to be like that, right? However, there are ways, in my opinion, to increase motivation, to allow some level of self-directed learning. And I would say of the two of us, Susanna is probably stronger on giving you some ideas on the more altering the curriculum and things like that. But as far as motivation goes, to me, I do think that we have a responsibility and a potential impact on people's motivation. We can't make anyone do anything, right? I mean, most of us come from a clinical background and we know this. Also, I have kids. You can't make anybody do anything they really don't want to do. But to me, it's about relationship and connection. If you can connect to some extent, you can bring people along. Now, let's say that you have a student who, on a scale of 1 to 10, is only motivated at a 2. You may only bring them to a 4 by caring about their life, being dynamic, showing them that you want to talk about what they want to talk about, whatever. But still, you brought them from a 2 to a 4. Now, for someone like you, who I think is similar to me, you want them to be like from an 8 to a 10. But if they come in as a 2 and they get to a 4, that's a big deal. So some of it I think is our expectations. But for me, so much of motivation is about connection and empathy. If the student comes and they seem disengaged, and our tendency is to kind of be like, well, they don't even care. Some part of our brain says that, right? Right? You admit, we're like, they don't even care. That's the person that we need to even more be like, what is it that you're hoping to learn? How can I help you to get where you need to be? It's that difficult client kind of thing, right? So I think we always have that opportunity. No, we can't build a course around one person depending on the operationalization of it, right? But the motivation part, I don't like the idea that like they come to us when they're ready, or they come to us and with whatever they have. That's, we all know how influential teachers can be. right? So if you can have that student who's just not that engaged, and all of a sudden you say something and they're like, oh, I'm actually interested. I actually care about this, you know? So I would say that to me, connection and relationship are key. And also probably looking at expectations, like I said, about where they are. If they started here and made it here, that's a big deal. And if we can tell them that, that's an even bigger deal, you know? And Susanna, I think, is going to talk actually now a little bit about like some of the ways you operationalize it. So maybe we can dive into that and then see if we've answered it or not.
Yes, thank you. Yes, I agree, Carrie. Connection and emotional connection and relationship is very important for motivation, but we must go further in motivation, and we must in our classes engage our students in the activities. I think that this is one of the key issues here. And how can we do this with small adjustments? It's true. From one hand, we must differentiate and respond to different styles and different interests and different motivations and different needs of our students. But on the other hand, we have a curriculum, we have 80 students class, and we have to find a balance between the ideal and what it is possible. One of the things that we must do is for achieve those principles in our teaching practices is having a good plan. A good plan, it's very important. And Carrie, please, for whom to plan? It is important for everyone. It is important for students and or trainees, because it is an opportunity to know in advance the learning path focuses on the student, the requirements, the teaching objectives, the skills and methods are included, so they know what is expected from them in the learning process. Planning is also important for us, for teachers, for educators, because it allows to organize all the work. It is an opportunity to reflect on our teaching strategies and improve it. Explanation of reasons and expectations. It's an action guide to better adapt and to help decision making. And assessment that allows considering previous experience, and this integrate this previous experience, not only ours, but only the students' previous experience. It's also important, and it's also an important factor for engagement, for involving and implicating our students in the learning process. Planning is also important for the institution, because it gives transparency and coordination and monitoring, which is also important. And for society also, because it's for disclosure and transparency that facilitates community participation and institutional exchanges. So planning, to have a good plan, it is important, and makes the process more reliable, if I can say so. So in digital education, planning is even more important, because students don't have to be at the same time doing the same kind of training like we are doing here. We are in this schedule, which is so different for all of us, but we are here at the same time, asking this, listening to the same contents and thinking about the same issues. When we are in digital education, especially in an asynchronous pedagogical model, as we have in the Portuguese Open University, The plan is more important, and it must indicate all the items that are important, that are organizational. For example, it must indicate the themes and the thematic units. Carrie, please, can you change the slide? Thank you. The themes and the thematic units, the content of each theme or thematic unit, objectives and competences that the student must develop, the schedule of each theme and e-activity, the selected materials that will be available to the students to work with, being links or articles or websites or whatever. The activities or exercises or tasks that the student must perform individually or in small groups, according to the objectives and the skills to be acquired. Communication channels with the student, between students and the professor, being the email, platform, message system, communication forums, etc., etc., and how the students will be assessed. Formative or summative assessment, assessment criteria, all these items are known by the students at the beginning of a class, of the program. At the beginning, they have all this information. And in the Portuguese Open University, we have an instrument, a tool, if you want to, that we call the learning contract. And I bring you an example. Carrie, please. I'm sorry to ask you, but and this learning contract is it's really a contract because it defines the level of structuring required in digital education. And at the same time, it includes a level of flexibilities that can be adjusted according to individuals and their training needs. And this learning contract is presented and proposed by the professor at the beginning of the semester, for example, and it must be approved by each student after the discussion. And during the discussion, it is possible to integrate some suggestions. For example, new content, which is important in that working context setting, for example, a different schedule because it's overlapped with some event at the work. I don't know, that is some examples, but these adjustments can be made. And this is also a way to go and meet the needs of our students in a proportion that we can deal with. The next slide will present you the structure, the real structure of our learning contract. It has a first topic about presentation, where we present the curricular unit or the discipline, the teacher, the school year. Then the second topic is about objectives, learning outcomes, then skills and competences to have developed at the end of that discipline, the contents or the subjects to be approached, methodology, all the orientations of this concrete pedagogical model, the resources or the learning objects, or the material, to the studying material, the sequence, for each theme and each activity we detail and schedule, and the evaluation, or what is going to be assessed and by which criteria. So at the beginning of the discipline, the student has all the information about what is going to happen during the semester, what he has to do to have a success in that discipline. And during all this process, the model is very collaborative, and they are demanding to have lots of interaction, and that is a way to once again reinforce their engagement, because they are invited to share their experience and to connect their experience to the contents they are working, the more theoretical contents they are working with. So that is a way to bring that content, which is new sometimes, which is theoretical, but bring them meaningful for their really and self-experience, being life experience or work experience, but it is also a way to do this. I saw that I had some questions in chat, Carrie.
Yes. Let's see what we got. Okay, I know some people had to leave, and we weren't really sure, to be honest with you, how long
Okay.
this was going to go. So I appreciate your sticking with us, those who can.
Mhm.
Okay, so Diana said, yes, Susanna, planning is very important. It also helps to keep students engaged. Use some evaluating strategies of your work. How did your teaching strategies help them to meet the learning goals? If they were you, what other strategies would they make for a better learning outcome and find pleasure and satisfaction in the process? Oh, that's great. That is a really nice thing you could ask your students for sure.
Yes.
We can ask you that when we're done. What could we do for a better learning outcome and pleasure and satisfaction? I like it. So,
Yes.
yep, go ahead. Do we have, okay. So, Rabia, I want to come back to you and put you on the spot a little bit. Does that somewhat help answer some of what you raised?
Sure. My vision, how can I say, get wider. So it was a great presentation, and I found lots of answers of my questions. Thanks a lot.
Yeah, and one thing we can do with this group is we can have people give suggestions and we can share, because honestly, I feel really strong. I feel very strongly about the adult learning principles, and I feel strongly about things like increasing motivation. But when you get to some of the self-directed things, I don't know operationally how to do it as well as some people do, because I've been more in traditional settings where you basically, this is your syllabus and this is what we do and everything's due at the same time and that kind of thing. So I understand that kind of like, well, how do we do that differently? And I'm relying a lot on Susanna to help me with that, and all of you who have done it before, different settings. So does anyone have any questions or anything they want to share? Because if not, we're going to move into, we'd like some feedback. Okay, Susanna, you want to speak about this a little?
Yes. So if you please go to this site in your laptop or cell phone, it can be done at the cell phone, menti.com, then you insert this code, please. And then you have a small questionnaire. And please answer it.
Will you do it now?
Yes, please.
Oh, okay.
Yes, please. It's very, very short. There's only four topics, and you have to rate each one of them from totally unsatisfied to totally satisfied. And this information is very important for us.
We want to have you do it while you're a captured audience, Rabia. I will put the link in the chat as well as the code.
And the code.
It's
Thank you.
menti.com, right, Susanna?
Yes. We have three answers.
Aisha said, thanks, Carrie. I have many things in mind and I'll keep sharing. That is perfect news.
Yes. Or have you already completed our questionnaire? And after that, we will send you another questionnaire, right, Carrie? A little bit more reflexive to help us to organize the next.
Right. So the next,
modules.
you'll get a quick Survey Monkey. So more what you're kind of used to getting that just talks about the value. And then also we'll ask about, we're going to give you some options of other andragogy and adult learning principles and kind of which one you'd like to do next, or we can rank them. We'll put it something like that. So, because as we mentioned at the beginning, this will be a module, you know, we'll have multiple modules. And if you think that, you know, kind of to the idea of being self-directed and flexible as adult learners, if we have a topic that you feel you don't need to come to, that's fine. If you have other topics that you feel are really important to you, then we hope you'll be there for those.
Is it possible to learn more about something about online learning and also in-person learning in the future, not now, but maybe add something about this topic also in the presentation? It would work well, because there are really, I think, big differences.
Yeah. Yes. So, you know, even though we have formulated this as being about like adult learning principles or andragogy, I think absolutely it would be appropriate to have something about, and that's something that Susanna and I have presented about at the conference and webinar. So yeah, I will make a note of that right now that we can put that. I'm sure that will be valuable to lots of people.
Mm-hmm.
Aisha, did you have a
Thank you.
question or comment?
Yes, I was trying to search the computer and raise the hand finally left it.
Oh,
Okay,
your sound
actually,
is really garbled.
Yes.
okay, let me turn my video. Maybe then it will be
Oh, okay.
fine.
But it was nice to see your face for a second.
Thank you. Actually, I wanted to share my experience, especially I want to share, maybe this will be very, maybe this will be a learning opportunity for others. Like, Kerry, you know, we recently had a MNS series UPC series, especially with Colombo Plan, which I was also conducting as coordinator, and Maria was also with me in another course. That was actually the instructor-led course on HEK, Health E-Knowledge Platform.
Right.
It was a very, very different experience. Number one, as Rabia said, it was all digital and we were using the technology.
Yes.
Secondly, there were a lot of adult learners from around the globe, almost like in my course, I was coordinating the universal prevention curriculum on environmental prevention curriculum. And there were almost 26, 30 people from almost 18 countries. And they all were not very much trained for using the internet. Number one. Number two, it was because it was instructor-led course, and we have synchronous sessions, 4 sessions, 5 sessions in almost in 2.5 months. We have only 4 sessions, but other than that, it was all the self-directed. And in the end, we had very interesting outcomes because it was also the pilot for this course. This is first time that Colombo Plan introduced the HEK platform. And though it was very wonderful experience, but some of the time we realized that our participants, like, they are not responding, like their digital walls are empty. They're supposed to finish the work, their assignments as per target, like they will finish the first module up to the 5th of the month and they will start the second module. But sometimes it was the 10th or 15th and their walls were still empty. So after a lot of discussions with developers and Colombo Plans, then what we did, we had to create a WhatsApp groups for a backup and motivation.
Yes.
And because it was very difficult for us as trainer and also as coordinator to carry all the activities well on time. So we created a WhatsApp groups, and then we kept on motivating them from morning to evening. Okay, today is your this target and this is your deadline. Now you are going to complete your this assignment and this assignment. And it was very interesting experience for me because I was also taking one course as a participant. Actually, I took that course earlier because I just wanted to learn how I can, carry the participants. So that's why I had an experience. If I didn't take that course, maybe that will be much more difficult for me to carry. So with this reference, I want Susanna and also the Kerry, maybe in our upcoming sessions, we can learn how, especially when we are digital and we are going to teach. Like I told you, we are just going to start the postgraduate diploma, and it will be more. I think 70% it will be online. So how we can motivate the adults, especially the seniors? They are in the field. Some of them, they used to send us email that, sorry, we cannot go to this. What is this HEK? And we cannot even log in. For 2 weeks, it was very much challenging to bring everybody on HEK platform because they had some login issues. Once they log in, they don't know how to proceed to the course. Okay, this is just wall, how to proceed next from this wall. So sometimes for adults, we have much more challenges in digital learning as compared to this formal learning. And it is making more challenging, but it seems like that the upcoming days are totally, everything is going to be digitalized, even it is a novel corona or no corona, but I think still we are now used to it. So
Yes.
it will be very great if we learn about the especially the motivation techniques, how we can use, especially on the online learning. Whatever we can do, we are just trying to
Yes.
do, but I think we need
That
to
was
learn
such a
more.
perfect story, such a perfect example. And I'm glad you brought that up because we've done something similar. And I didn't even think of that as a great example where you pivoted based on what the adult learners were, the information they were giving you, even if they weren't giving it to you directly. I've had that too, where we set up like an online portal or place to talk and they don't. But then if you set up WhatsApp, they're on there talking, or to your point, if you set up accountability in a different way. And
Yeah.
I'm a very committed student and teacher, but with how busy I am, if you say you have to comment on this platform, but then no one else does and no one seems to be checking, I'll probably stop commenting on that platform, right? I mean, I think that's just like a human nature. So, yeah, that's great. Well,
Yes.
I see that a few people have had to leave, and I know I had scheduled it for an hour and we went over, which is good information, and I'm glad that we were all committed and had a lot to say, but I do want to wrap it up just for respect of all of your time. Thank you for being so participatory. The questions are amazing. And remember that this is an ongoing conversation and an ongoing class. So we're not done, we're just pausing for today. And Zana, did you want to say anything else before we close out?
Just thank you for the participation and for sharing all these experiences and information. So, and the feedback, it was very, very nice for us, Carrie.
Yay.
And
Good. Well, this is an esteemed group, and I'm
yes,
feel honored to
it's
present
true.
and to talk with all of you. So it's really more of a conversation, and we will continue.
Yes. Thank you. Thank you to you all.
Thank you all.
Thank you,
Have a
everyone.
great rest of
Thank
your
you.
day.
Okay, bye-bye.